The title of our SURF presentation is Your ACE Score Could Mean More, and the PICO question we attempted to answer was how does an ACE score greater than or equal to 4 influence high-risk behaviors such as substance use, risky sexual activity, and alcohol use versus an ACE score less than or equal to 3.
Some background on ACE scores. ACE score stands for Adverse Childhood Experiences. ACE score testing began in 1995 when the hospital Kaiser Permanente conducted a study to see how childhood trauma affects the brain. ACEs can refer to a number of adverse experiences, including physical abuse, sexual abuse, parental neglect, parental alcoholism, parental divorce, that have occurred prior to the age of 18 and pose substantial risk to the subsequent development of negative health outcomes. This brief specifically looks at how having an ACE score increases a person's likelihood to engage in high-risk behaviors that include alcohol use, risky sexual behaviors, and illicit drug use.
This brief specifically critically appraised 6 different articles, the first being National Household Survey of Adverse Childhood Experiences and their relationship with resilience to health-harming behaviors in England, published in 2014. This was a level 4 survey. Results showed a relationship with the number of ACEs and an increase in the number of health-harming behaviors. For example, the prevalence of having had or caused unintended teenage pregnancy was more than 5 times higher in those with 4+ ACEs. The second article was titled Adverse Childhood Experiences and HIV Sexual Risk-Taking Behaviors Among Young Adults in Malawi, published in 2018. This was a level 4 nationally representative cross-sectional survey. This study found that as ACE scores increased, the probability of sexual risk-taking behaviors went up, contributing to increased engagement in infrequent condom use and multiple partners. This was seen in those with 3+ ACEs.
The third article we looked at was Outcomes Related to Adverse Childhood Experiences in College Students, Comparing Latent Class Analysis and Cumulative Risk, published in 2019. It was a level 4 retrospective cohort study that found, in regards to alcohol use, relating to our PICO question, it concluded that individuals who have an ACE score of 5 or more are more likely to engage in irresponsible alcohol use as opposed to those who have an ACE score of 4 or less.
The fourth article we looked at was Association Between Adverse Childhood Experiences, High-Risk Behaviors, and Morbidity in Adulthood, published in 2016. This is a level 4 cross-sectional survey. The results of this data supported that ACE scores greater than 4 were statistically significant for binge drinking, heavy drinking, current smoking status, and high-risk HIV behavior. The fifth article we looked at was Impacts of Adverse Childhood Experiences on Health, Mental Health, and Substance Use in Early Adulthood, a cohort study of an urban minority sample in the US, published in 2013. This is a level 3 retrospective quasi-experimental design, and the authors concluded that those with an ACE score greater than 5 showed increases in depressive symptoms, anxiety, tobacco use, marijuana use, and alcohol use.
The last study we looked at was Patterns of Adverse Childhood Experiences and Substance Use Among Young Adults, a Latent Class Analysis, published in 2017. This was a level 4 cross-sectional study, and it revealed that the individuals that they had categorized as high or having multiple ACEs reported more alcohol-related problems, current tobacco use, and psychological symptoms in comparison to those in the low ACEs category. The study specifically looked at how a trend in ACE scores going up influenced participation in these behaviors.
To conclude the results of this brief, 4 of the 6 articles suggested that ACE scores greater than or equal to 4 increase the amount of risk-taking behaviors. 2 of the 6 articles showed that ACE scores below 4 or trending upwards can create a higher incidence of high-risk behaviors. The research concluded that having an ACE score as low as 2 and as high as 4 or more can result in participation in high-risk behaviors. These results can be applied to clinical practice. For example, nurse researchers can use this information to learn more about the lasting effects that ACE scores have on long-term health.
Nurses at healthcare facilities can also utilize this information for early intervention and prevention of negative outcomes associated with high-risk behaviors secondary to high ACE scores.
Lastly, nurses and healthcare providers can use this information to educate patients on what ACE scores are, the lasting impacts of an ACE score, and help healthy coping mechanisms to replace high risk behaviors.